All right, final exams are just around the corner. And you know what that means? It's time to master urinalysis. In the next few minutes, we're going to break down everything you absolutely need to know to ace this section. So let's just dive right in. So let's kick things off with the big question. Why should you even care so much about urinalysis? Well, think of it like this. It's basically a liquid report card on the body. It's this amazing, non-invasive window into what's going on with someone's metabolism and, crucially, how well their kidneys are working. Okay, rule number one for any exam, to spot what's wrong, you gotta know what's right. And normal urine, it's actually super simple. It's about 95% water, but that other 5%, man, that's where all the good stuff is. That's where you'll find the solutes. The two big ones to remember are urea, which is organic and comes from breaking down protein, and chloride, which is your main inorganic player. First up, the physical examination. We're talking about first impressions and those initial clues you can get just by looking and, yeah, smelling.
So check this out. The color of urine can literally point you straight to a diagnosis. Now for your exam, pay close attention to the red category. This is super high yield. If you see cloudy red urine, you should be thinking hematuria. That means intact red blood cells. But what if it's clear red? That's a totally different story. That points to hemoglobinuria, which is free hemoglobin from busted up red cells. See? Just a simple look makes a massive difference.
All right, let's talk about clarity, or how cloudy the urine is. This is absolutely critical for your exam. You have to know the difference between the bad stuff, the pathological causes like bacteria and WBCs, and the totally harmless, non-pathological stuff. And here's a classic exam trap: refrigerated samples. They often get cloudy with this pink or white stuff from amorphous crystals. Don't let that fool you. Know the difference.
Okay, specific gravity. What is it? It's basically how well the kidneys can concentrate or water down the urine. And if there's one number you need to burn into your brain for this topic, it's 1.010. That number is your baseline. It's the specific gravity of the plasma filtrate when it first hits the glomerulus. When urine has that exact SG, we call it isosthenuric.
So that brings us to this range. Seriously, write this down, make a flashcard, do whatever you need to do to memorize it. A healthy kidney can produce urine anywhere from 1.002 to 1.035. But here's the kicker, the big red flag. If you see a patient whose specific gravity is stuck at 1.010, sample after sample, that's a huge sign their kidneys are in trouble and have lost the ability to do their job.
And hey, don't forget about your nose. I'm serious. This fruity, sweet odor, it's a classic giveaway for ketones. This is one of those associations that I can almost guarantee you'll see on your exam. The second you hear fruity odor, your brain should immediately jump to ketones and conditions like diabetic ketoacidosis.
Okay, moving on from the physical exam, let's get into the chemical deep dive, reading the Regent strip. This is where we build on those first clues and get some hard data.
Now, we're not going to go through every single pad on the strip. Instead, we're going to focus on the ones that are the most high yield for your exam. Each of these little squares is testing for something specific, and each one tells a really important part of the story.
Okay, listen up, because if you only remember one thing from this entire chemical section, make it this: protein. Protein in the urine, proteinuria, is the #1 indicator of renal disease, period. Think of the glomerulus as a really fine mesh strainer. It's not supposed to let big things like albumin through. So if you find protein in the urine, it's a massive clue that the strainer is broken, that there's damage to the kidney. A positive protein test is a big deal.
Next up, glucose. The glucose story is super straightforward. See, your kidneys are constantly working to pull all the glucose back out of the filtrate, but they have a limit. When your blood sugar gets too high, we're talking above the renal threshold of about 160 to 180, the kidneys just can't keep up. They get overwhelmed and glucose starts to spill over into the urine. That's why it's such a key indicator for diabetes. So what happens when all that glucose is in the blood, but the body can't actually use it for energy, like in really poorly controlled diabetes? Well, the body panics and starts burning fat for fuel instead. The byproduct of all that fat burning is ketones. And that's why finding both glucose and ketones in the urine is such a critical, flashing red light combination. It points you straight toward diabetic ketoacidosis.
Okay, this is a brilliant point for your exam, so pay attention. The blood pad on the dipstick is a bit of a liar. It doesn't actually detect blood cells, it detects heme. So a positive result could mean one of two things: intact red blood cells or just free-floating hemoglobin. So how on earth do you tell the difference? You have to go back to your physical exam. Is the urine cloudy? It's hematuria. Is it clear? It's hemoglobinuria. You have to connect the dots.
All right, let's talk about the liver. Bilirubin and urobilinogen are like a diagnostic dynamic duo for figuring out what's going on with the liver and bile ducts. Now, obviously, an increase in bilirubin tells you something's wrong. But here's the pro-exam tip. A complete absence of urobilinogen is also a massive red flag. Why? Because it means there's likely a total blockage in the bile duct, so bilirubin can't even get to the intestine to be turned into urobilinogen in the first place.
Now, this one is probably one of the most useful practical tests on the whole strip. It's a quick screen for UTI. Here's how it works. Lots of common bacteria, think E. coli, have this little enzyme that takes the normal nitrates in your urine and turns them into nitrites. So if that nitrate pad turns positive, boom, you've got a really strong indicator of a urinary tract infection. Okay, it's time to put it all together. Let's connect the clues to the conditions. Because look, the real key to crushing your exam isn't just memorizing what each test does. It's about seeing the patterns and understanding the story the results are telling you. All right, let's run through a quick case, just like you'd see on an exam. You get a report back that shows a positive nitrite, the urine is cloudy, and the pH is high. What's the first diagnosis that pops into your head?
If you said UTI, you nailed it. And think about why it all fits together so perfectly. The cloudiness, that's from the bacteria themselves. The positive nitrite, that's from the nitrate-reducing bacteria. And the high pH? Well, some of those little bugs also split urea, which creates ammonia and makes the urine more alkaline. It's a perfect textbook fixture.
Okay, let's do one more. This one's a biggie. The results show high glucose, positive ketones, and you've got that fruity odor we talked about. What critical condition are we looking at here? This pattern is a screaming sign of diabetic acidosis. And this isn't just some abstract diagnosis. This is a full-blown medical emergency. Being able to spot this combination of clues is unbelievably important, not just for your exam, but for saving a life in the real world. So, to wrap things up, I want to leave you with one final thought to chew on while you're studying. Of everything we've talked about, which single abnormal result would worry you the most and why? Really think about it. Is it the protein, the glucose, the blood? Figuring out your answer will help you lock in which of these findings really has the most serious implications. All right, that's our quick guide to urinalysis. Now go crush that final.